Lip lifting was initially described in the mid-20th century for reconstructive purposes, and it wasn't until the 1960s and 70s that it was incorporated into aesthetic surgery. And it didn't really gain much popularity until the early 2000s, and especially starting 2010. A big part of that is because it's a neglected portion of overall facial rejuvenation. Our brows start to droop, our eyelids fall, our entire face comes down, and we lift all of that. Except for the central portion of the face, the nasal tip, so rhinoplasty, and the upper lip as it elongates. These two procedures are often, even now, neglected when it comes to facial rejuvenation. But what is a lip lift? A lip lift is essentially reducing the distance of the base of the nose to the upper lip. Or, in the case of a corner lip lift, reducing some of the redundant skin so the tucked in or inturned corner of the lip comes back outward. Some people genetically have a long upper lip, and some people develop it with age. And regardless, it can throw off our facial balance. Sometimes when we smile, the upper teeth don't show as well. This could also be related to VDO, or the vertical occlusion, related to the length of the teeth. So it's important a good decision is made in regards to whether or not this is an issue of the teeth and you might need veneers, or is it an issue of the upper lip and you might need a lip lift surgery, or both. Sometimes it can even be related to the nasal tip. I don't want to get into too much of the detail of this. It's important that a correct evaluation is made so you make the right decision and don't end up with a surgery that you didn't need. Lip lift surgery has two kinds. As I mentioned earlier, you have the central lip lift, which is the modified bullhorn incision. It's hidden essentially at the base of the nose. It heals generally pretty well if done correctly. If we do it in the deep plane, meaning don't just take away skin, but also take away some of the SMAS, which holds tension, generally it heals very well. A part of scarring is related to your genetics and post-op care and a number of other factors. But delicate surgery, correctly done, definitely plays a big role in having a good scar too. I offer all my patients 6 weeks post-op, a session of laser that helps, or microneedling depending on skin type. Lip lift surgery can be done under local anesthesia or general anesthesia. Very often, I combine lip lift surgery with my deep plane facelifts or with revision rhinoplasty. Sometimes with primary rhinoplasty, but primary rhinoplasty patients are generally younger, so if we're doing it, it's for a genetic long upper lip. In the revision patients, regardless of age, generally the problem with the revision rhinoplasty is that the tip has started to droop. So when we lift it back up, then all of a sudden all you see is the upper lip. So we want to reestablish that balance. Recovery is very quick and easy. The sutures come out day 6. And generally the incision is red for a couple of months, just like on any other incision. And then it heals to a fine pencil thin white line as it heals. I hope this answers some of your questions. If you have any additional questions, feel free to reach out.